Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi ta'ala wabarakatuh. Greetings to all distinguished guests, participants, speakers and mentors. I wish everyone well during these challenging times. This COVID-19 pandemic has made us to observe a new normal, and hence why I'm delivering a keynote virtually today. Ladies and gentlemen, it is important now than ever that we win the war against diabetes. While COVID-19 has become a national and international public health priority, causing great damages to our lives and livelihoods, we should not lose sight of our continuous fight against non-communicable diseases, especially diabetes. Just last year, the National Health and Mobility Survey found that nearly 4 million Malaysian adults have diabetes, which means 1 in every 5 Malaysian adults suffered from this disease. What concerns me is that Malaysia's diabetes prevalence rate has increased rapidly in recent times. If this is not reversed by 2025, diabetes prevalence will shoot up to more than 30%, with an estimated 7 million adults suffering from diabetes. This is indeed worrying, as diabetes can lead to many other complications, such as renal, eye, heart, and vascular complications. A recent report published by the Ministry of Health stressed that NCDs, including diabetes, cost the Malaysian economy 9 billion ringgit in terms of productivity losses. This economic cost includes absenteeism, presenteeism in the workplace, and the premature death of labour force. This is in fact a conservative estimate. Aside from economic losses, NCDs also place a serious burden on our health system. Over the years, the Ministry of Health has done a lot to prevent and control NCDs in Malaysia, guided by the National Strategic Plan for NCDs. However, there is still much more than we can do. For instance, the proportion of adults undiagnosed with diabetes is still high in Malaysia, despite the availability and accessibility to health screening. Diabetes can be asymptomatic. However, it only takes a simple finger prick test to find out your blood sugar. Hence, it is important for us to develop an effective and yet cost-competitive approach to motivate all Malaysians to get screened. With the advancement in technology and growth in the medical industry, diabetes management has progressed to meet the rising burden of disease. The treatment has also continued to evolve to ensure diabetes management is easily accessible for the public. However, according to the latest National Diabetes Registry Report 2013 to 2019, only 32.4% of patients who sought care in Ministry of Health primary care clinics achieved optimal blood sugar control in 2019. Ladies and gentlemen, we need to develop a better approach to empower diabetes patients to win the war against the disease and to enable them to live a fuller life. Empowering patients also requires a team effort from everyone, including doctors, nurses, pharmacists, dietitians, nutritionists, family members, and most importantly, you. You have an integral role to play in the prevention and the control of diabetes. We need Malaysians to live healthily to prevent diabetes. We need Malaysians to get screened regularly for early detection of the disease, and we need Malaysians to seek treatment early to prevent disease complications. My future youth leaders, this Digital Youth Hackathon complements our continuous effort to fight diabetes. I'm pleased that this serves as an interactive platform for everyone to exchange ideas. I hope to see creative diabetes prevention and control ideas from the youth and how we can operationalize it into concrete actions. Through this hackathon, my wish is that the youth of Malaysia will kickstart and continue the effort in raising diabetes awareness in the community. This Digital Youth Hackathon is also an apt and timely choice in conjunction with the World Diabetes Day. I applaud Sanofi's efforts for organizing this event along with the youth organizations Arus Academy and Undi 18. On that note, I officially launched the Sweet Spot Malaysia, a digital youth hackathon for diabetes 2020. I thank you.